7th Annual Policy and Budget Conference, Medicaid on the Move. My name is Brewster. I'm the Executive Director of the Economic Progress Institute, and so grateful to see so many old and new friends here today. For those of you who are new to the Institute, we are a research and advocacy organization that promotes policies to improve economic security and opportunity for Rhode Islanders. We also work to ensure that the state has the resources it needs to fund vital public services that help build a strong economy, like education, infrastructure, affordable housing, workforce training, and health care. I want to start by thanking our wonderful sponsors this morning who help us underwrite the cost of this event. A big thank you to our lead sponsors, Neighborhood Health Plan of Rhode Island and United Healthcare Community Plan. I want to thank the AFL-CIO, the AARP, and the Roman Catholic Diocese of Providence, as well as United Nurses and Allied Professionals, Community Provider Network of Rhode Island, the Rhode Island Health Center Association, Gateway Healthcare, the Rhode Island Parent Information Network, Bank Rhode Island, and Family Services of Rhode Island. Thank you so much. Also a special thank you to Blue Cross Blue Shield of Rhode Island, who underwrote the cost of some tickets for people who are here today. So thank you to them as well. I want to thank our philanthropic partners, the Rhode Island Foundation, Neil Steinberg, Yvette Mendez are here. Thank you so much for being supporters since our inception. To the Stoneman family, the Annie Casey Foundation, the Carter family, and the Robert Wood Johnson Foundation, and so many other individuals and corporations who support our work. Thank you. I also want to recognize my colleagues, Linda Katz, our co-founder and policy director, our senior policy analyst, Rachel Flum, who's celebrating 10 years with the Institute, and our newest member, who's celebrating 10 weeks, Juan Espinoza, who is our Community and Outreach Associate. Thank you all for being here, as well as Grace Evans, who is off to Harvard next year and has been helping us out at the Institute. And I also want to recognize some of our board members who are here this morning, Carmen Diaz-Jusino, Alan Flam, Joe Grady, and Deborah Linnell. We could not do this work without you. We are happy to have some elected officials here this morning. I want to welcome Representative Tanzi, Representative Handy, Senator Miller, and I believe Director DePena is here, or is coming, so thank you all for being here as well. Lastly, a huge thanks to our presenters this morning, all of whom have dedicated their lives to enhancing the public good, and in particular ensuring that all Rhode Islanders and all Americans have affordable health insurance and quality health care. We are live on public radio, Latino Public Radio, on channel 1290 AM and at lprri.org, where you can follow the conversation. And the Twitter handle is @Nuestra Salud, which I learned means our health. So that just expanded my Spanish vocabulary by 2 words. Thank you, Pablo, Dr. Rodriguez, for being here this morning. It's wonderful to have you. As I just mentioned, this is our 7th annual conference, and each year we focus on timely state policy topics. Along with the economy, Medicaid has certainly commanded significant attention this legislative session, though it may be losing ground to the Pawtucket Stadium, Red Sox Stadium, but this is way more important. When we set the date for the conference, we did not know that the timing would be so appropriate. The Reinvent Medicaid Work Group issued its short-term recommendations just last week, and those will now be vetted through the budget process. And the group now shifts its focus to longer-term Medicaid reform. Today provides an opportunity for the Governor and Secretary Roberts to share both the recommendations and longer-term reform plans, and to bring to the public conversation Cindy Mann's vast experience with healthcare and Medicaid reform at the national level and with individual states. Improving a program that has such a wide reach across our residents, our businesses, and our economy is no easy feat, and we will take all of us working together over a sustained period of time. So let's get the conversation started, and please feel free to participate in the conversation by using #MedicaidOnTheMove.